Currently at Lee County Care and Rehabilitation Center, we are providing services in physical therapy, occupational therapy, and speech therapy. Basically, when a resident or a patient arrives to our facility, those three groups of therapy, physical, occupational, speech, will want to address the patient's declines or basically when a resident comes to our facility, we will want to address the patient's declines, even their goals. Is this patient or resident wanting to go back home? Well, then that's when we sit down for our full life conference with the family and the resident, and we were going to look at, do you live in a mobile home? Do you live in a 2-story house? And what we're looking for is trying to work on things that will return you back to your home. And if not, if you're deciding to be a long-term patient in our facility or a long-term resident, then we're wanting to try to get you more accurate to move around in the facility, to become more involved in facility activities. Mainly when we pick a patient up on what we call our caseload, we ideally try to at least give them services in physical, occupational, and speech therapy at least 5 times a week out of a 7-day period. However, we do try our best to, if there is a need for weekend therapy, then we also try to address that and make sure that it's provided. Typically, we see a patient anywhere from 5 times a week for upwards anywhere from 4 to 12 weeks until we at least acknowledge their goals and to strive to achieve those goals. And if not, then we can put them on an appropriate plan with restorative nursing and move on down to the just basic nursing care. Previously, we spoke about how we sit down in our full life conference and we decide what the residents' goals, the family goals is in regards to their therapy treatment. In a lot of situations, it is to get them back to their home, to their loved ones. So what we try to do, that's how we set our goals to return to that prior level of function, which would be their homes. So usually about 2 weeks prior to our discharge or prior to them no longer needing skilled therapy services, we like to do home assessments where we can come in, do recommendations or help in modifications of the home so that they would be more likely to achieve their functional independence.